Hi. Hey, welcome to This Week in Pharmacy. I'm your host, Todd Urey, founder of the Pharmacy Podcast Network. We have an interview with Dr. Brandon Antinopoulos with PPCN. I want you to look at that first, and then I have some things to share with you. Sorry for being late. Talk to you soon. Hey, This Week in Pharmacy, we're in the studio. I love when we're in the studio live with someone here instead of doing these Zoomies. I like Zoom and I like talking with pharmacists, but when we get a chance to have someone in the studio, Dr. Brandon Antinopoulos, one of my favorite pharmacists. I've been following you since your P2 year at Pitt.
That's it. Yeah.
And Brandon was one of my first supporters of our T-shirt brigades campaigns that we had. The first one was the RX rated shirt, which I have to bring back. I love that shirt. And then your wife did this amazing, she sewed together like a bunch of your stuff. We'll have it on show social media, but I loved it. Like, you've been a huge supporter of me personally, but your support for community pharmacy has been pumping through your veins since you were a P2. Like, why is that? What was it about community pharmacy that you just are like on fire for?
So yeah, I mean, the immediate, I would say the catalyst was, my time at the University of Pittsburgh School of Pharmacy. And I was very fortunate. We had a lot of good folks in that class. Kyle McCormick, who's now running Blueberry Pharmacy.
He was just down here.
Yep. And a lot of folks that are, you can see now in national and regional leadership positions. We just had a really good class, and we had a lot of great mentors, even with our faculty. So personally, for me, it all started with Dr. Melissa McGivney. I came to her with a group of us with this crazy idea. It was like, hey, we're being taught all this, clinical stuff, medication therapy management and STARS related measures and the impact of pharmacy. And I grew up in pharmacy. So, I was born and raised in independent pharmacy. My parents, my father was a pharmacist, mother non-pharmacist, but they started a pharmacy in 1997 within our hometown. Even before then, my dad was always working for local independent pharmacies. So, I can remember the earliest of my days, 5, 6 years old, no babysitter. I was in the toy aisle of the pharmacy, reading Sonic the Hedgehog comic books. So I think that's where my love of community pharmacies, like it's in my DNA, because I've lived it my entire life. But I never knew the potential of where I could take it, or my passion for helping preserve access to community pharmacy and community pharmacy services until my time at the University of Pittsburgh. So, group of us, we came to Dr. Melissa McGivney, said, hey, there's this opportunity with a local health plan to get paid to do MTM through Outcomes MTM. We don't want to see this opportunity go away whenever we graduate. So we want to like hit the ground running, and we want to go into all these pharmacies and coach them of how to do these opportunities so that they can be successful. And also, thankfully, we had still have an amazing dean, but at the time, Dean Pat Croboth, as well as their senior associate dean Randy Smith. I mean, they were extremely supportive of us being able to personalize our education and experience, and really, they just threw the gas on the flames and said, "Here, just let's run with this." And from there, it sparked this little group we called ourselves the CLIP team, or Top Drug. CLIP stand for Community Leadership, Innovation, and Practice. They still have these areas of concentration that are like CLIP based, and they take about 10 or so students every year, teaching about practice transformation, enhanced services, a lot of the stuff that we're doing in PPCN and CPSN. But I think if it was without that, as well as getting involved in my state association, that seems to be, if there was like a point that I could say where it all started, that's where it started.
I'm glad that you kind of transitioned us to talking about PPCN, because that thought of driving clinical follow-up from what a physician sets the stage for, digging into diabetes management or hypertension or something else that these patients they're getting diagnosed, and then all of a sudden it just falls apart because there's no one really following up with the treatment as we move forward. Pharmacists were positioned in their communities, understanding what their patients were going through, as well as them as people in their, as long as sometimes third, fourth generation customers and clients. And to be empowered by an organization like CPESN, and then PPN kind of grabbed the baton and ran with it from all of the states that have an opportunity to grow it. What was it about Pennsylvania that caught fire? Like something happened. Something was very special. I'm biased. I'm from Pennsylvania. I'm a Pittsburgher, but it's Pennsylvania, North Carolina, and I can't remember the other state that's just on fire. That they're just standing out. What was it about PPA, and shout out to Vicky and Pat Apple and starting it all. But what was it about Pennsylvania? Why is PA Pharmacists Care Network just on fire right now?
Yeah, that's a good question. I think for us, if I had to tell the story of, how are we here? I don't think a lot of folks realize all the time that has been spent on where we are today with, growing to 200 pharmacies as part of this clinically integrated network of the Pennsylvania Pharmacists Care Network, also a local network of CPSN USA, which represents in total about 3,500 pharmacies, across the country, with this dedication for providing enhanced services to patients within the communities. For us, I would say PPCN, as you see it now, I think really started to get galvanized whenever CPSN was starting to materialize, operationalize. The Flip the Pharmacy initiative that, started in 2019. Even before then, PPCN was working at our local level with a contract with a Medicaid MCO for pharmacies in the network to get paid for services. But even well before, this 2018, 2019 period, our state association in the Pat Apple at the time, the board of directors at that time, even before I was a student, we're talking like in the early 2000s, saw the need for our pharmacies in Pennsylvania to have a way to be able to get paid for the services that they were providing. Invested money, invested time, went out and sought grants to kind of be like startup funding to be able to put together and materialize what we did now, what we have now. And even, I was a resident, PGY1 community practice resident. Again, love Pitt and being mentored by Dr. Melissa McGibney so much. I was like, you know what? I got to do this for one more year. Sorry, mom and dad. Like, I know this wasn't the plan, but just give me one more year. And really the person that took convincing was my wife, who was gracious enough for me to delay a full pharmacist salary for one more year, but stayed on as a Pitt and resident, partly funded by the Pennsylvania Pharmacists Association, to really kind of start the boots on the ground work of materializing the Pennsylvania Pharmacists Care Network. So, we've been at this for a while. Thankfully, as we were looking to do something, CPSN started to formalize CPSN USA, and recognizing that there were other states that wanted to do this and needed to do this. There was opportunity for engaged payers, a lot of data and a lot of evidence that showed pharmacies could do this coming out of North Carolina, down there. So it was really kind of, all of us starting to work together. And as well as, I think, the foresight of our leaders in our state through the association, collaborations with schools of pharmacy, collaborations with pharmacy owners that recognized we need to do this, and made the appropriate investments needed to do so. That's where I've seen kind of challenges if we look across the states, doing what our state association invested a lot of money to be able to do this. Yeah. And I don't think a lot of people realize that, and still continues to invest a lot of money in doing this. And that's why, I'm here. I started within this role as president and COO back in March of this year. But
congratulations, by the way.
Oh, thank you.
I'm so proud of you.
Thank you. I've always been connected and driven to do more. My mission in life has always been to create opportunities for pharmacists to get paid for the services they provide, and ensure that communities have access to community pharmacy. And so, I've always kind of been involved in my roles in and out of the years, but it felt like welcome home doing this and kind of getting the work hand on hand with the group. And we're growing. The network's growing. I mentioned we have 200 pharmacies. We're currently onboarding close to 20 pharmacies within this month.
Incredible.
And a lot of that's support by a lot of industry partners that really, I think everyone just kind of recognizes the need that we need to preserve access to community pharmacy, and this is one of the ways to do so.
I'm looking at the map right now. You can't see it if you're listening to the podcast, but if you go to papharmacistnetwork.com, you'll see the map. It's all over the place. And I'm telling you, this has come a long way. You can obviously see heavy concentrations in the Pittsburgh and the Philadelphia areas, but surprisingly, it's spread out through the entire county, all of the counties within Pennsylvania. This is exciting because, you know, someone who has meticulously followed the pharmacy profession since around 2004 when I started blogging, and I did it because I didn't know anything about pharmacy. I was from telecom, and I started tracking progression of long-term care and senior care pharmacy specifically. And as someone who has kind of been the storyteller since we started the podcast and collected all of this content, we're at an inflection point. There is no more, am I going to do this when you're a community pharmacy owner? It's you have to do it now. Bingo. Because of what's happening with DIR fees, the DIR fee apocalypse that's coming in the beginning of 2024, and staging yourself to transform from the old-fashioned pharmacy setting, which still did all of these services. They just didn't get paid. So it's not that what I see PPCN doing and CPSN doing is finally maturing and finally programmatizing. Is that a word? You're kind of bringing together the maturity of these turnkey programs so that I'll bet you any community pharmacist that's been in community pharmacy for 5, 10, 20 years that look at your programs would probably be like, well, wow, like I'm already doing that, but this really solidifies it, quantifies it, brings in the data, brings in the proof points so that when some payment system or source wants to pay me, I have all the backing as to why you would pay me for this.
Yep.
Because that dispensing fee and governing pharmacy care based on a dispensing fee is ludicrous in this day and age. And now, just like you and I said before we started recording, so many things are happening that a physician their time is being crunched, and they're diagnosing and they're making some decisions, and then they hand the baton to a home care organization or a nursing home or a specialist. Well, guess what? 9 times more than you're seeing your physician, you're seeing the pharmacist. Hand the baton to the pharmacist. Hand the baton to someone who understands diabetes or hypertension or HIV or some condition that needs to be ongoing and monitoring. But then, for goodness sakes, let's find a funding source to pay for it so that those patients that aren't being monitored by a caring, resourceful organization like a community pharmacist that knows how to do this, then that patient goes back to the emergency room because no one's caring for the condition.
Yeah.
And I think it's almost like do a little bit and take a little bit of money to care for these people, and instead of these gargantuan ER bills that come
Absolutely
out, you know.
Yeah.
And it's just not good health.
No, it's not. And I think even if you look at, you know, patient-centered outcomes or patient satisfaction with the experiences, I think even that is, you know, everyone just kind of wants to be, they want to be taken care of, you know, they want to be cared for, and they don't want to be taken advantage of.
Yep.
And you know, I think that's the heart of the roots of, you know, care, whether it be in primary care, whether it be in community pharmacy. You know, that was always the spot in which a trusted relationship with a provider, even if there were all these other challenges and structures in place to make that interaction a challenge. But still, at the end of the day, you know, that's where the value is in those relationships, those trusted relationships, the community having a central point to say, like, you know what, I have this question and I can't get an answer from who I'm interacting with. And I have the sense even those I'm interacting with want to give me an answer, but just don't have the time to do it. Where do you go?
Yep.
You go to the pharmacy. And so, you know, we need to make sure we do everything that we can, not just for ourselves and for the pharmacy profession, but, you know, for our patients, for our communities, for our payers,
Yep.
for the government, for employers, for health insurances, to make sure we preserve that access so we can continue to take care of these folks. A couple things I want to touch on as you were talking, for the pharmacies, like you had mentioned, like you have to do this.
Yep.
I think I was actually listening to Bruce Nealon, who said this, and it stuck with me. Through all his years and his journeys and stories on the road, you have to dispense medications excellently. Like if there's one thing you have to excel in pharmacy, it's that. And to me, that is medication synchronization, inventory management. Aside from, we talk about the benefits of MedSync and what it means like for clinical opportunities, just as an operational workflow, like that is the way. And even the touch point with the patient ahead of time and all that. So that's what we see even from pharmacies that are performing very well in our payer program opportunities. Like that's their workflow, 80% of their workflow. The second thing is it takes a team. Doesn't always have to be the pharmacist doing everything. Even if you're in one of these positions where it's one pharmacist and one tech, and that's how it was at Hometown Apothecary Drugs, where my family's pharmacy was, that I got my chops in. We still figured it out, and it wasn't me doing everything. I utilized my technicians. We had an intern. I would say the pharmacies out there too. It's like you got to be doing MedSync, and you got to have your whole team and your whole staff involved. And if you're doing that, just pick one other thing clinical. I mean, it doesn't even have to be clinical, but what does your community need? And what are they willing to, what are they willing to, this is going to sound bad, what are they willing to pay for that's maybe not covered as a benefit? Because again, like provider status is, to me, is really just you've communicated your value to someone who's willing to pay you for a service, providing a service. And many times there is a population within our community that recognizes the benefit of services that pharmacies provide, and they will pay for it. And again, generating non-PBM dependent revenue streams, again, to further help with, what's coming in 2024 and make sure that we can ensure that access. And it does take a team. And that's the other thing I think with us and PPCN and CPSN, it's not just me out there doing this stuff. I mean, we have the greatest executive director of our local network, Stephanie McGrath. I mean, really, she takes a lot of the credit for where we are today, or at least should, because she's the one out that's developing these relationships with the payers on behalf of the pharmacies, working with the folks at CPSN USA to launch and manage these programs. We have a lot of support from CPSN USA to be able to do this, and there's a lot of boots on the ground people from our luminaries, which are other owners. Other folks that we have helping. We had Nicole Hassan, who was with Value Drug, but was a contracted service implementation lead. Kelsey Hake, who's a director of engagement for us, but based out of the University of Pittsburgh. And there's a lot of other folks locally within Pennsylvania that dedicated a lot of time, effort, sweat equity, even just giving their own time to make it what it is. So, it takes a team to keep these things going. It takes investment, which our pharmacies are investing, and our state association's investing, and we're going to continue to invest to make opportunities simple for our pharmacies to take care of their patients. And then we're also going to invest in, again, this is one of the things that I would love if we could accomplish in Pennsylvania. I want every Pennsylvanian to know what a PPCN, CPSN pharmacy is, and the difference between a pharmacy within our network versus one that's not in the network, or the typical pharmacy. Stephanie and I, we were on a call with a payer potentially looking to launch a program, and they asked one question. They were like, if I walked into PPCN, CPSN pharmacy, how would I know?
Yep.
I thought, that's a good question. We maybe have some window stickers or something like that, but we really need to raise up the brand of the community pharmacy enhanced service network, as well as locally with our Pennsylvania Pharmacists Care Network, and make headway into, again, every Pennsylvania needs to know what a PPCN pharmacy is and what it means.
As a person who loves marketing and loves logos and design and branding, it's really everything that I've done since I entered pharmacy specific to technology, but now it's more about messaging in this publication and raising the voices of our pharmacists doing things. When I look at it as a non-pharmacist, what PPCN is and what CPSN is, all of your branding, this is my opinion, shout out to Jay over at CPSN, I'm going to be calling you, but all of your branding is marketing to pharmacists and doctors and nurses. And I don't feel like it's branded for the consumer.
Yeah.
I feel like we have to simplify it, almost like a stupid campaign, not stupid, but a simple campaign that would be like hashtag PA cares. And then if you're a PA cares pharmacy and it has like a heart around the Pennsylvania state, shape of the state, and then there's like a heart around it and it says PA Cares. If you're part of a PA Cares community pharmacy, you're going to get all of these other services. Something that simplifies so that we can communicate to our communities. Why is this important that you're part of a PA Cares pharmacist, the PPCN pharmacy, and what do you get out of this that you're not going to get out of, number one, the chains, number two, the mail order, for God's sakes, can't stand it. And then number three, maybe a community pharmacy that isn't it, but maybe the client, the patient could walk in and say, hey, are you a PA Cares pharmacy? And then they're like, no, but I should be one, because why wouldn't you be one?
Right.
Let's take a break so that I can ask some questions about PPCN, because back in my day, I was very sensitive to the number of pharmacies within a state because of the attention that I was giving to the state association so that we could get more eyes and ears around content that I was helping to develop. I remember Pennsylvania having right around 870 pharmacies. Is that how many that there are out there?
Yeah, I think roughly. I think the last number I saw based on I think like NCPDP count or even like IQVIA data, I think Independence was just over 800. Now there are some, I always estimate 900 because there are some that are like chain independently owned, and we have some of those that are part of the network. But yeah, I would say that's pretty close, or a good estimate.
So I'm listening to this podcast right now. I'm a pharmacy owner and I'm like, okay, but make this simple for me. How do I get started? How do I get enrolled? What's the lowest hanging fruit? Like, where do I start as a pharmacy owner? Because there's a lot of stress on pharmacy owners right now. It's probably daunting to thinking about bringing something out to my community that's pretty intensive from the perspective of ownership. And then it's like, well, now it's one more thing that I have to manage. So I'm going to be the ebb and flow here in this conversation, where I'll be the conundrum negative Nelly person and ask you a bunch of questions with my arms folded and being like, yeah, but I don't have anybody to launch it. The temperature is now almost boiling because you can't sit around anymore. We have to do something. You have to implement a PPCN program if you're a Pennsylvania pharmacy. If you're in another state, you need to reach out to CPSN. But let's tell the listeners why. And let's break it down and make it simple. How would they get started?
So the first thing to do, really just to reach out to us. You can do that through the PA Pharmacists network.com website, or even CPSN's website through the contact or join links. That's how we can get the information to follow up with you. Next steps from there, we walk you through our process. Everyone within our local network within Pennsylvania has to go through delivering enhanced patient care training. It's 10 hours, 6 hours online training live, and 4 hours live, and like a webinar training. It is CE approved, so you're going to get CE for it. But that training is very important, not only just to orient you to the network, but two, that's what gives us the ability from a quality assurance standpoint to go to these potential payers and say, hey, Brandon's pharmacy is in Pittsburgh. Todd's pharmacies in Philadelphia or even Todd's pharmacies in Brownsville.
Yeah.
But this training, and we teach the pharmacist patient care process, and how that standard process every single time, regardless of what the service is, regardless of the workflow, like that's the process that we teach, and we teach how these enhanced services fit into that process. That's what helps ensure that, regardless of what pharmacy a patient might go into and what location, they're going to get the same level of service and care every single time. So very important. After that, we walk you through the steps to enroll your network into us with Pennsylvania, as well as the steps to enroll within CPSN, the agreements, the fees to participate. For us in Pennsylvania, pharmacy total costs $199 a month for the participation fees. That's your investment to be a part of the network. And a lot of that goes into the infrastructure, the reporting needed for us to be able to be a clinically integrated network. As well as, again, our great team, their time and going out and getting these payer contracts to support that for the pharmacies. And then after that, you have the opportunity to enroll in whatever payer program that's available to you. Right now, we currently have 3 very substantial payer program opportunities with managed care organizations throughout the state.
Yeah.
And, our pharmacies in Pennsylvania are generating, on average, so this is even like the very high engagers and the ones that, are at least just starting to dabble in it, but they're generating a little over $1,000 a month, average. And so, again, the ROI is there. For our pharmacies, our payers are happy and they continue. We're actually going to be expanding one of those payer programs to offer additional services to our pharmacies, to be able to do social determinants of health screenings, which our pharmacies are doing too. But, really just reach out to us through the website. The training's a requirement. The monthly participation fees are a requirement. But we have a lot of support and tools and resources to walk you through, how to be successful, and a lot of examples and other pharmacy owners willing to talk to you about how to do that.
Yeah. And then you have to, once I become a PPCN member, I have my training, we have to communicate what we're doing for our communities and why it matters. So when I said lowest hanging fruit, I meant, or what are the conditions that we could start with to make it easy for our communities to understand the value that we're presenting that may be different than what we weren't doing a month before we started PPCN, enrollment. So I'll just make it easy for, So if I know I have 30 diabetic patients, do I start in diabetes? Do I start hypertension? Do I start in some condition which it's an ongoing opportunity for me to engage the patient? If I get them in front of me, if I get them on telehealth, if I get them in my pharmacy, it's an opportunity to make more money from them, but also keep them on track in order to keep them healthy. So describe that to the listeners too.
Yeah. So, and this is, I would say the same thing whenever I was coaching pharmacies as a Good Neighbor Pharmacy business coach before coming and joining PPCN.
That was a good boot camp, by the way.
Oh,
that was amazing.
Yeah. Yeah. That was, I missed through the years coming to the wholesaler shows and being able to, any show, to being able to interact and engage, and they threw on a nice one. So, but you pick one that you're comfortable with and you're passionate about. The big thing that we mentioned is MedSync workflow. You got to have that MedSync workflow.
Okay.
Even if you don't, and you're going to start somewhere, I'd say just start with that. Get 20, 25 patients, get them through a MedSync workflow. CPSN has resources available through Flip the Pharmacy, and even through flipthepharmacy.com. Like, anybody can access that. You don't even have to be in the network. Those were all supported by the Community Pharmacy Foundation. That's freely accessible to everyone. NCPA through their Simplify My Meds program, if you're an NCPA member. They're great. Their videos do a great job. Shout out to Kevin Day, who is the managing network facilitator for CPSN USA and a pharmacy owner back when I think he was a resident with NCPA or student on rotation. Wow. He's featured in those videos.
That's cool. We're all getting old.
So there's resources out there the start there. And but as far as like a disease state, or am I going to do social determinants of health screening? Am I going to educate and counsel patients on their diabetes or manage their hypertension? Just pick one to start with. Even just pick 2 patients, 3 patients, something. You just got to start somewhere.
Yep.
You got to build the confidence, because I think that is the other thing, is like, oh, this is so far ahead of what I'm doing or what I'm able to do. It's like you got to start somewhere. So pick one area, pick what you're passionate about, pick what you're think is going to be the confidence builder for you and your team to dabble in. The same thing works out well with even other services. If we're offering, if we want to improve shingles vaccinations or pneumonia vaccination rates, I've seen a lot of pharmacies where they try to say like, okay, we have these 3 things that we want to do, or we're signed up in. Here's how you identify the patients. All right, go get them.
Yep.
And that just implementation process doesn't seem to work pretty well. So I would coach my pharmacy to say, like, just pick one a month. Tell your staff, like, hey, for this month, everyone who is on a statin, we're going to talk about CoQ10 supplementation. Give them the talking points, have them only worry about identifying that and focusing on that. Now, you just gave them a month to only have to focus on one thing.
Yep.
It builds their confidence, builds their skill set. Now, next month, we're going to focus on shingles vaccine, offering Shingrix. Look for this type of patient within workflow through that MedSync workflow, and make the offer. And so I think, the MedSync's the big thing, and just starting small. Just pick one area and do something that you're passionate about, because then you won't feel like it's selling, or you won't feel like it's a new skill you got to learn.
Yep.
And start simple.
I think of, just to shout out things that could be bolted into the PPCN playbook, I think of identifying medications that aren't working for patients based on absorption, or breaking the medications down through PGX, through pharmacogenomics. I think of point of care testing. I think of sexual education courses for parent and children to come to your pharmacy to understand the dangers of unprotected sex, and just basic things that could tie into, diseases that could come from that kind of education. I'm thinking of pain management. I'm thinking of, obviously, diabetes, hypertension, but there are so many things that every single community has people in their community that are suffering with that.
Yeah.
So it's already there. Your community already has the conditions in place. You just almost have to siphon out in stages, just like you said. 1 month, you're doing this, 1 month, next month. By the time you hit your first year of practicing something 1 per month, by your second year, you're going to have a ton of business that's coming in to your pharmacy for more than just a refill, or more than just filling a prescription. Because the people that are coming in for an antibiotic that is a one and done client or customer, if you had a questionnaire, you had someone slowing them down saying, hey, we're here for the total family. I know that you're going to be on this antibiotic for the next, how long, a month or 90 days or whatever it is.
Yep.
So, but let's talk about your whole family health. Let's talk about your, what's happening in your home. Do you know that we do this, and this to really help? I mean, we're talking about, like, even Terry Forshee has this turnkey lifestyle management program that helps with weight management, and that in and of itself could become a profit center for you. And when I say profit, there are a lot of pharmacists who are just good-hearted, transparent people that, and Lisa Fast teaches this all the time, profit is not a 4-letter word. So if you're in community pharmacy, there is absolutely, as long as there's value, and there is, but as long as there's value to you as a clinician and you as a pharmacist, there's nothing wrong with because if you're taking their money for something, a supplement, a disease state management, or whatever, then they're living better. Like their health is literally better. So please make money from it rather than it either A, going to the emergency room, which is the worst, or B, it being farmed out to a national chain or some other organization that's never going to do the job that you're going to do as a community pharmacy. But in kind of wrapping up and closing up, what is the shout out to the non-network community pharmacy owner right now that isn't part of PPCN here in Pennsylvania? And then the pharmacies throughout our 19,000 plus other ones that are out there, what's your shout out to them?
You know, I would just say, again, we're at this point, you know, 2024, and I think Troy Trickstead, our executive director of the CPSN USA, he said it best, you know, and I'm a golf fan too. He said, you know, that 2023 it's Saturday. This is moving day. Mm-hmm. You know, we put in the work on Thursday and Friday, but you know, the tournament, if we're going to win or not, starts tomorrow. It starts Sunday.
Yep.
And 2023 is moving day. So you're either putting yourself in a position, your pharmacy in a position to still be around in 2024 and take care of patients. And that is through growing non-dispensing revenue. You still have to do that very well. There's still profit in there. It just takes a little bit more effort and time than it used to be whenever my family owned the pharmacy in 97. But you got to do that well, but you got to do something to get into non-PBM revenue. Join our network. That's going to open up opportunities to be able to capitalize on some of our payer programs we have, to be able to do that, to put you in a position to win on Sunday and get the green jacket.
That's awesome. I like that. Shifting for us nerds, because you're a nerd like me.
Oh yeah.
I just started watching one of the new Marvel kick-out movies from Disney Plus. It's called Invasion. Have you started watching that?
Secret Invasion. Yeah, I started last night. It's only
episode 1's out, so
yeah,
I watched it last night too.
Yeah. But I fell asleep before the.
I have to watch it again.
Yeah, I do. No, it was a long day, and I am a you know, my nightly routine is kind of like when it's all said and done, the kids are in bed. I have my glass of box wine. And, you know, everyone who knows me, they always, you know, crack a joke, be like, Brandon, come on, you're you know, a pharmacist now. You're in this position. You can afford more than box wine. I'm like, hey, I like my box wine, and I still have my student loans to pay off. When I get them paid off, then I'll you know, start drinking from the bottle. So no, you know, my routine was the wine. You know, watch a little TV, and that's the one I started. But yeah, whenever, you know, I woke up, you know, still relaxing in my chair, I'm like, oh man, I gotta go back.
I gotta watch it all over.
Yeah. But no, I am like complete, you know, Marvel MCU nerd and Star Wars nerd.
Me too. I am. If you're listening and you're not a nerd like us and don't watch that, please give us a shout out. Let us know what you do like to talk about. But we appreciate what pharmacists are doing. Pharmacy Podcast Network is dedicated to all things amplifying our pharmacist voices. If you are a state organization that would like to use our platform to push more of your provider services and enhanced care services, please reach out to us. Brandon, we have to have you back. I want to have some kind of rotation that you come to Brownsville and come to the studios and talk. But I love that you got to visit us here in the studios. Thank you for being part of This Week in Pharmacy. And thank you for what you're doing for our profession, because you are not the type of person that you're going to sit still. So watch what happens to your career over the years. I know I'll be watching, but I just wanted to thank you for being here.
No, I appreciate it. And hopefully, you know, looking forward to coming back throughout the years to keep talking about it and keep talking about.
We'll bring some more pharmacy
independent pharmacy. Oh yeah, absolutely. Absolutely. No, it'll be a good time. I know I've seen you've had few of our pharmacy owners on here and stuff.
Eric was here. Eric Cushy. I love that guy. He owns 4 pharmacies here in Fayette County, and he was just on RxSafe's podcast talking about compliance packaging, and we touched on some of the things you talked about today. However, there is a blueprint that PPCN has that's ready to go, and it's just like, if you're listening and you're not part of this network, just reach out to even Kyle McCormick could even like teach you the cash-based side of folding in other clinical services. Is Kyle part of PPCN?
He is not.
Okay.
He is not. But he, I can't speak for him, but he supports us. Yeah.
He practices
it. Yeah. He supports. There's, he could tell you, again, our programs, again, everything's kind of based on dispensing claim data as far as where patients at, and that's part of his model is, he doesn't operate in that world.
Right.
But, it's still very supportive. He and I talk regularly. We're like each other's support group. So, cool. Even though he's not in the network, not a reflection of, him kind of sitting on the sidelines, he's definitely making things happen.
He could become part of the PPCN special forces. That could be like the outlier when we start growing, because his network's growing too. Yeah. His whole, cash plus or pharmacy plus is cost plus model is growing. So shout out to you, Kyle. We love you too. We want you back. Hey, thanks for listening to today's This Week in Pharmacy with Brandon Antinopoulos. Dr. Brandon, we enjoyed having you. And if, like you said, you want more information, please go to PAPharmacistNetwork.com or go to CPESN.com. That's CPESN.com. And we thank you for listening.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
Welcome back to This Week in Pharmacy. It's kind of like part 2 of today's show. This is the live version. Sometimes we don't have the scheduling capabilities of getting people into the studio like Dr. Antinopoulos, which he's such a busy guy that they come in. We want to record live, but we share with you recorded. If you're listening, it probably really doesn't make a difference if you're just listening to the podcast portion. I want to jump into some news. This came up in my Twitter feed. So I want to talk to you about, Twerk's news and things that are happening. I want your opinion on this content. First of all, this just came up in my Twitter feed. This is corners are cut to dispense prescriptions. CVS employees tell Ohio Board of Pharmacy. This news just came out. It was reported on July 7th. And this is shocking. This is an example, and I'm going to pick on big corporation CVS, not the pharmacists, not the technicians, not even maybe middle management, but the organization is eating its own young, literally. And here's the literal part of it. CVS owns a PBM, and they're part of the PBM conundrum, the 3 largest ones, that have created a system that suck out the majority of that revenue that is being used for insurance into the form of profits, or at least a big portion of it, or too big of a portion of it in the form of profits. Not enough of it is going to paying our pharmacists, paying our technicians, putting on extra pharmacists for safety, putting on technicians where need, evolving the evolution of how a pharmacy operation works at such a high level of client / customer need. People need their pharmacists. Guess what's happening? They're closing pharmacies throughout the country, and they're slashing hours, and it's all based on the PBM model. I know the pandemic had to do part of this. You know that the pandemic had an impact on this, but this is frustrating. This is this should tell Congress, this should tell our government, this should tell the American taxpayer and the American worker out there worried about healthcare that CVS Health must change their bigger policies around how things get paid, because it's literally impacting their own pharmacies in communities that need them. Enough of that soapbox, but very frustrating. Once again, tell us what you think at Pharmacy Podcast on any of the social media platforms. Hey, let's talk about Mark Cuban. So when Mark Cuban came out with Cost Plus Drugs through his work with Dr. Alex, and they were actually featured on Pharmacy Podcast Network's shows, we actually interviewed their CEO of Mark Cuban's Cost Plus Drugs. It's such a mouthful. And then, of course, we referenced other organizations and other people that Dr. Alex and Cost Plus need to be a part of. They need to join forces with the NCPA. They need to look into becoming a wholesaler. They need to look in other portions of pharmacy. And this is all in the interview. It's interesting that now they're entering into launching a biosimilar for Humira. And this is reported on Reuters, and it states in the headline, Mark Cuban's online pharmacy set to launch Humira. So this is really good news. I predicted in its current form when they launched this that they would go out of business within 2 years if they weren't doing something with independent community pharmacy, becoming a wholesale driven, and expanding on more than just being another online pharmacy, because the online pharmacy does not connect the long-term value of where pharmacy can go and where pharmacy is going based on the current payment models and business models. And I was very scared of this organization, which it's definitely starting to change, which is exciting, to becoming another lowest to the bottom race for pricing, with sucking out the value of what pharmacist and pharmacy does for healthcare. It isn't a commodity. It's not a race to the bottom. But once again, current models, encourage organizations to be that way. So Mark Cuban and Dr. Alex is mixing it up, and they're starting to think of the future and how entering specialty spaces is a great idea, but specialty will lead them to doing more partnerships with clinicians on the ground, pharmacists that will work with them in order to execute other services that go along with the medication, because we all know it's not just the medication. So look that up, read more about that, and keep that in mind in moving forward as a pharmacist, as a pharmacy professional. How can we start partnering with organizations like Mark Cuban Cost Plus Drugs? Hey, let's jump to community pharmacists can be better understood, can better understand, implement social determinants of health. And this is put out by Pharmacy Times. And it was a webinar titled Breaking Barriers, Improving Health Outcomes Through SDOH Screening in Community Pharmacies. 3 expert panels discussed the use of social determinants of health with a focus on screening and referrals. Did you know that there are 15 million Americans that are within parts of the United States that are underserved areas, which are known as pharmacy deserts? 15 million Americans. And so that brings to attention the services that are local independent community pharmacies and the roles that they play. And it also sets up the double checks into why are we missing pharmacies and healthcare services within specific communities that's impacting 15 million Americans. Pharmacists have something to say about that. And you would know, if you research this information, if it's nearby neighborhoods that you could have a direct impact by talking to your community legislators and your state Congress, and get them involved in understanding that as a pharmacist, maybe it's a business opportunity, especially if you're a community pharmacy owner, to reach out and to be a part of the solution. But reach out to us, because we want to continue to research social determinants of health and the concepts that are coming from pharmacists specifically. But take a look at this article from Pharmacy Times. All right, before we get on with the rest of the show, I want to talk about Twitter. This whole subject to me is really interesting. Um, so does everybody remember not too long ago, if you're listening, if you're a longtime podcast listener, you probably have heard of Mastodon, which was a new, well, not so new. It actually has been out for a while, but it's a open source, very privatized driven. People can set up their own server environments where you kind of create a closed environment of people interested in specific things. And Mastodon came out, and of course, there were pharmacists on Twitter that were using hashtag TwitterRx that were commenting and making negativity comments towards Twitter about probably more about political issues than the actual platform. And that when we think of healthcare providers, and I think of our purpose, not that we're not allowed to have personal opinions. I think everybody is entitled to their personal opinions and then the responsibility that they have based on what they do, especially for our physicians and pharmacists and nurses, where you're actually impacting people's lives through the healthcare that you deliver to them. You almost take an oath. When you took the pharmacist oath, you kind of said, I have to serve and I should serve under my oath, regardless of politics, really. And I think that that's the case. But let's keep it from a technical perspective and what Elon Musk is trying to do to keep Twitter relevant as a platform, as we see all these new platforms coming out. Uh, TikTok's all the rage right now. Instagram's still very popular, but it seems like our social media, which I'm around long enough because I'm old, to see social media's dawn in its very beginning, MySpace, for example, and how things change, brands collapse, platforms collapse, and if they don't reinvent themselves, they'll die. Guess what that sounds like? It sounds like pharmacy. It really does. So I'm going to compare this article. Is the end of Twitter? Is this the end of Twitter? What to know about Threads and Facebook's new Twitter? They call it the Twitter killer, which I kind of laugh at that because I think Twitter is actually going to go the route of reinventing itself. I think Elon Musk is too much of an innovative person, and I think he has a lot of pride in this platform and the fact that he's really wanted to be very freedom based in order for the user to say and post what they want whenever they want and say what they want, with of course some normal boundaries of things being shown in order to comply with uh, international accepted law through publishing and content, as well as the United States where it's based. Obviously, that there's some boundaries, but I think we've learned through analytics and through studies that things are drastically changing in the social media world. And it really reminds me in parallel with what's happening in pharmacy. And that should tell you something as a pharmacist, as a pharmacy owner. If you're listening right now, a pharmacy student, if you're listening right now, pharmacy, to be valuable and to continue to be paid for and to actually grow in services, because it has to, based on the clinical need, especially for a lot of the chronic disease states and especially rare diseases that are coming out, is going to take pharmacists that are innovative at heart and of mind in order to create and continue to create value in what pharmacists do. And it isn't dispensing. It really isn't. Dispensing is going to go the way of AI and in automation and machines. And the services that are going to be needed in our public and our communities based on the coming of lack of physicians is going to create so many new opportunities with pharmacists and what you're capable of doing. And it might not even be medication related. You might become a pain management specialist that's after the medication is implemented based on your recommendations as the pharmacological expert, and then digging much deeper into ongoing pain management, almost as a preventative measure by looking into the holistic side of medications and the coming use of technologies and the new TENS devices that give tiny little electronic shocks, and how you could study up on that and become an expert in the balance between medication and pharmacological and technology and devices. And and how Click Therapeutics is going to be looking for experts and for partnerships in specialty drug treatment management, and how digital prescriptions and and technologies are going to be used to literally manage disease states. So please, if you are in pharmacy right now and you are frustrated, you feel stuck. You might be in a chain environment. You might be in an independent environment. Burnout can come from anywhere. Fall back in love again with being a pharmacist. Reach out to our organization and connect into 50 plus of our hosts that have amazing ideas and what they're doing, what they're driving. None of them are sitting still. Every single one of the hosts that drive content through the Pharmacy Podcast Network are doing something amazing, and they don't want to do it by themselves. They want other pharmacists to join forces in doing things that haven't been done before in maternity, in women's health, in specialty care, rare diseases. Home care is just exploding. Shout out to Happier at Home, who's our partner in helping with community pharmacy, alternative revenue sources, with services that your communities need. Reach out to us. This is not just about podcasting. Actually, it's not even about podcasting at all. It's just the channel of social media and of communications that I accidentally chose in 2009 to start developing instead of blogging. And now it's blown up into this network of the most brilliant minds in pharmacy, some of the most innovative people in pharmacy. Become a part of it and network with us. Come ask us for help. Pharmacy students, pharmacists, pharmacy technicians, businesses. Once again, this is a network. If you're not a member of RPH Ally, please join RPH Ally. Go to rphally.com. Reach out to Sean and Kevin. Dr. Kevin Walker and his team are just amazing. They're putting together a conference that's coming. I will be on vacation, so I am going to have FOMO all over the place, fear of missing out on that conference. It's going to be an online environment. I think it's July 16th through 18th or 17th through 18th, but please look it up. Search RPH Ally. Look at their online discussions. Just support them, support each other. Reach out to Pharmacy Podcast Network for really anything that we spoke about today, anything that you think that we're missing that you'd like to help develop content on. That's how this network has grown to over 100,000 plus listeners per month. We're so excited about our growth. Hey, a shout out to FDA doing podcasting through us. Now they're going to be replicating some of their and amplifying some of their content, as well as Peace Corps. Look that up of what's coming. Hey, have a great weekend. This was Todd Urey, This Week in Pharmacy. We'll talk to you next week.